Good afternoon. Thanks for joining us for the call. My name is Stephanie Mercado. I'm Executive Director and CEO for NAHQ, and I'm joined here by Len Parisi, Vice President of Quality Management for MJHS Health System in New York. Len served as the faculty for the program that we're going to talk with you about today, so thanks, Len, for joining us. I would also like to thank those individuals from QIN/QIO, the Quality Improvement Network Quality Improvement Organization for Illinois, Iowa, and Colorado, who are joining us on the call today, as well as all of the participants who completed this certificate program. Today, we want to share with you some exciting news about NAHQ's expansion into supporting care across the continuum. While NAHQ has deep roots in acute care, we understand that healthcare across the continuum is really critical to improving patient care. And as we continue to define and teach and certify healthcare quality, we know we can do that in more care settings, really supporting a coordinated and competent workforce and thereby advancing the profession of healthcare quality. So let's get started. So the story begins in 2015 when we were noticing a quality gap. The QIN/QIO saw an opportunity for nursing homes to improve quality on some pretty important measures. The executive director at the time reached out to NAHQ. She knew NAHQ was known for supporting quality care, and with the only accredited certification in healthcare quality, our CPHQ, it really made sense for her to connect with NAHQ first. When I met with the QIN/QIO, they shared stories of staff in nursing homes who are really doing their best, but we're also really challenged to keep up with the changing expectations for quality, as well as the normal day-to-day patient and resident needs. For example, staff really wanted to improve by reducing pressure ulcers, UTIs, and overutilization of antipsychotic medications. At the same time, CMS reporting requirements and public reporting of quality performance were really heating up. So these demands left the staff feeling pressure and really needing a new way to work and new tools to get that work done. Also, as you may know, in nursing homes, staff attrition is often quite high, and it's really difficult to keep momentum on important activities that support quality. So these issues were compounding and they were confounding, so an action plan was really needed. The organizations partnered, that would be NAHQ and the QIN/QIO, and our quest was really clear. We wanted to develop and leverage nursing home staff to improve quality while making their jobs easier, not harder. At that point, the QIN/QIO submitted a Special Innovation Project Award application to CMS to support this effort, and it was approved. We met to craft a plan to meet these needs. While a solution to meet this need seemed to be training and the CPHQ certification, we knew that many staff might not be ready for the mid-level content that the CPHQ offers. We might need to start simple with the fundamentals of healthcare quality instead. To be sure and to confirm our hunch, we proceeded to convene focus groups. The first was of individuals supporting quality in nursing homes. These would be the people who identified themselves as quality professionals. And that was really a varied group because oftentimes there isn't a designated quality function in these nursing homes. That being said, we quickly realized the passion that these folks had for their work, and we also saw challenges. These individuals come from different backgrounds, have different roles, and many may or may not have had healthcare training. They wanted to support improvement, but needed the tools, and they needed permission from their leaders to do this work. Many thought that the quality function was the job of leadership and administrators and not their own role directly. When we met with the administrators in a focus group, the challenges on their end were illuminated as well. They were facing pressures from CMS and public reporting. They understood quality care is now not just a promise but a measurement, and that to continue to get referrals, they needed top quality service. And they felt like the role of the quality was positioned well at the care level. So the individuals who were on the front lines, they felt like were in charge of quality, while the others felt like the quality role was really in the executive offices. So we have a disconnect, and we had a common view, but really we're looking at trying to figure out who is in charge of quality. So to address the need for more resources and more tools to help prepare the staff, we began by using NAHQ's existing HQ Principles course, the fundamentals, and customized it for nursing homes and QAPI. This content was first tested in a live format in Illinois and Iowa, and then later put into an online learning format that can really be self-paced by the learner. Because QAPI is so critical to the success of a quality improvement program, as well as it's a requirement from CMS, a special focus was placed on the framework and putting that into the content. QAPI stands for Quality Assurance Performance Improvement, and it is a comprehensive framework for ensuring high-quality care. It's data-driven, proactive, and improves the quality of care. A successful quality improvement program in long-term care requires certain QAPI elements to be in place, and those are listed here: design and scope, governance and leadership, feedback data systems and monitoring, performance and process improvement, and systematic and systemic action. So now let's take a deeper look at what the online course has to offer. So the online course was born of the live course, and it has several components that really maximize learner engagement and experience. This includes a pre- and post-test self-assessment to allow learners the opportunity to self-reflect before diving into the content, as well as a pre- and post-test to measure the knowledge gained. 6 interactive learning modules focused on these topics. We focused on the evolution of healthcare quality so that everyone had an appropriate background on healthcare quality and its intentions. QAPI, quality improvement process and methods, using data to make decisions, teamwork and communication, and of course putting it all together, the future of healthcare quality. We also provided plenty of tools, templates, and resources for the participants to put their knowledge into action. And this is what's really so great about the program. The participants having access to so many resources that can support the individuals and the team even beyond this individual learning experience. And finally, we supported the learners through a project where they put their new knowledge to work with supportive quality tools. They picked an improvement opportunity like reducing UTIs and pressure ulcers and antipsychotic medication utilization. They worked with their site and with peers remotely and had access through collaborative sharing calls to a coach in Lynn Parisi, who will speak in a moment. They were also supported day-to-day by the QIN/QIO, who are really the boots on the ground in these nursing homes, helping to advance quality care. Participants who completed all of these requirements were awarded a certificate of completion. So even after the conclusion of the program in February, though, we really didn't view our job as done. We were not finished. We went on to engage administrators and executives and offered an executive coaching session, which was also hosted virtually by Len, who shared the business case for quality. At NAHQ, we believe a fully supported approach is the best approach, and away they went. Now let me hand it over to Len to talk about the results of the program and the learnings overall.
Thank you, Stephanie. As Stephanie mentioned, the program was offered to professionals charged with leading quality initiatives or providing senior management support for quality activities within each nursing home. These professionals may hold the title of administrator, director of nursing, or other manager title, as well as some clinical coordinators and others responsible for data collection and analysis. The program was launched in September of 2016 with 300 participants representing 121 nursing homes across Illinois and Iowa. Many of the homes participated with teams of 2 to 5 clinical and ancillary staff members. The timeline for participants to begin and complete the program was September 2016 through February of 2017. 45% of participants were either directors of nursing or administrators, and the roles of other participants included nurses, directors, supervisors, unit managers, MDS coordinators, and other social service workers. The participants completed a pre- and post-course self-evaluation which measured their comfort level and confidence with 11 specific topics covered in the online modules. The participants' confidence across the 11 topics increased substantially after taking the course, and those items which were identified as not comfortable were very, very few. The nursing home participants were also required to take a pre- and post-test related to the course content and score 80% or greater to be able to receive the NACU Certificate of Completion. We are delighted to report that the average score increased by more than 27 percentage points, with the pre-test average score being 63.9% and the post-test average score being 91.3%. At the conclusion of the online course, the participants also completed a program evaluation. And a question very familiar to many of us who survey, one key question asked was, how likely are you to recommend this program to others? The responses indicated a very positive reaction to the course, with almost 80% of the participants saying they would recommend this program to others. These responses were consistent with the informal feedback we received through the program from the QIN, QIO, who are regularly in contact with the nursing homes they recruited for the program. Another key question was asked on the evaluation. What will you do differently following participation in this program? Participant responses illustrated the practical hands-on value that they all perceive from the course. Some of the responses we received are, I'd follow the plan for root cause analysis and have teams look deeper for root causes rather than just assuming what the cause is, clearly valuing the use of data. I'd focus on system improvements rather than just individual improvement. I would increase the frequency of PDSA cycles in finding solutions. I would involve all the facility employees in the process and performance improvement teams and include more staff in decision making. I would use data to drive the QAPI program and make sure improvements are always data-driven. And I'd review data more frequently to make informed decisions and use a dashboard for displaying data and communicating more effectively. Additional follow-up surveying and data analysis will be conducted by the QIN, QIO to help measure long-term results and how the teams are working to sustain improvement. NACU is proud to support this work and is very pleased with the results of this program. As a healthcare quality professional, regardless of the care setting we work in, it is important to recognize that quality work happens across the continuum. As I often say, it is imperative that healthcare quality professionals have a deep understanding of healthcare quality across the continuum and the impact that this work has on quality and safety, improved care transitions, and outcomes. NACU is dedicated to this and here to support the professionals who are doing this important work every day. The program also serves to heighten awareness of quality across the continuum and the consistent application of the science and principles of quality management. This signals an important shift in growth opportunity for the profession. It's truly an exciting time. I want to thank all of the participants who took the time to complete the program. We are very proud of the work you do every day to make a difference in the lives of your residents. So now I'd like to turn it back to Stephanie, who will tell you more about what's next.
Thanks, Len. Well, because NACU has always been the group that's been focused on defining, teaching, and certifying healthcare quality, what we're going to do next is we're going to keep doing that. We hope that we will continue to engage and train the nursing home staff so that they can attain the CPHQ certification, because it's really a logical next step for them. You know, more than 10,000 quality professionals currently hold this designation, and we think this level of competence in nursing homes would really help improve the quality of care. Again, this is just really a logical next step for participants, and we hope that they continue their journey. We're also planning to invite these participants and all of NACU's members and non-members to our annual conference, which is NACU Next in Cincinnati. That's going to take place this September. We know that when the quality bug bites you, training and peer support are really important for professional growth. And then there's always HQ Essentials, which focuses on advanced and master practitioner competencies across the six domains listed here. This is the top-level content that NACU offers and really takes a deep dive into where the profession and healthcare quality are going and some of the top-line skill sets needed and competencies needed to really advance healthcare quality. And for those thousands of nursing home staffers who did not participate in the program, the online learning modules and pre- and post-test certificate program will be available online beginning in July of this year. We really want to make sure that the program is expanded because NACU has this content developed, and it's really easy for us to offer it to more individuals outside of this initiative. We hope that through our marketing and through your word of mouth, we can bring this content to more nursing homes and increase the quality of care for all patients. So this wraps up our presentation, and now we would be happy to take questions from the audience.
You can enter any questions you have into the question box on the right-hand side of your screen. Give it a moment for some to come in.
So we have a question about the content related to nursing homes and even extending beyond nursing homes. And it's related to the fact of which kind of, do we have content that is introductory in nature but not just guided towards nursing homes? The answer to that question is yes, we definitely do. And the rooted framework for all of this content, both for nursing homes and our other HQ Principles content, is really the same. We just happen to customize this offering for nursing homes. It can additionally be customized for other delivery settings as well, but we do have the general HQ Principles offering that is available online as we speak, and also is a pre- and post-test course and has a certificate attached to it as well. We just additionally have niched out into this nursing home space, and I've been really excited to do that.
We have another question, is what's the best way for me to introduce this content to my colleagues?
So a couple ways. This presentation is being archived, and so it will be available on YouTube, and we will send it to the participants after. So you can forward this link to this presentation directly to those individuals as a way to introduce the concept. Additionally, if you're seeking some potential talking points or things that you would need to sort of, move this through your upstreams and to help people understand the impact that it could have for your organization and for patients and residents, we can certainly help you with that. You can reach out to info@nacu.org and just request a little bit of support with that, and we'd be happy to help. We get those requests very often. And we can also provide customized demos. Occasionally we'll provide a 1 or 2 day license for this content so that you could really try it out and see if it's going to fit for your organization. And then you will have the confidence to really make sure that this is exactly what your organization needs before you proceed.
We have a question from Jeremy asking, how might extended care facilities use this as an opportunity to partner better with the hospital?
I can answer that question a little bit, and I'll ask Len to join in to this dialogue as well. I mean, I think that in terms of partnering with hospitals and other care settings, particularly the acute care, I think that this is a wonderful partnership opportunity, especially because of the referral networks and some bundled payment arrangements. I think that really this content should be a proof point to acute care settings that your organization is committed to continuing to be educated and trained in the highest quality standards, and that that you have experience doing that. So I think it's a great bridge between those two. But I'll let Len jump in because I know he has deep roots in this work.
So I love that question. Thank you, Stephanie, and you'd answered it beautifully. But what I'd like to add to that is it's really important for quality professionals to be able to sit down at the table and have an understanding of quality metrics across the continuum. And also, as you brought up, the credibility that's brought to the table when having discussions with partners across the continuum and a deep understanding of the quality metrics from the same perspective of the skills, the knowledge, the scientific approach to quality management are essential and really strengthen the dialogue and also strengthen the credibility of the organization. So that's a great question.
Awesome. Great. We'll wait a couple more minutes for maybe another minute or so for additional questions if they pop in. I'll take the opportunity to just build on one more point while we wait and see if anyone else has a question. But to the extent that, you know, the acute care providers are seeing an opportunity to support the nursing home staff, I think this is a great way to where this content can flow both ways. So what I mean by that is certainly we want the nursing home staff to take initiative and leadership and continuing to develop their skills and competencies in healthcare quality. And that's something that they can do on their own through this program. Additionally, if acute care environments are seeing a gap in some of the service and quality levels of their nursing home providers, it's a great opportunity for them to get engaged and mention to their nursing home counterparts that this might be a good way to get a level of baseline knowledge. So we see the beneficiary of this content certainly being in the residents and the patients, but certainly anybody who's involved across the continuum in managing the delivery of this care. Okay, well, it looks like that was our final question, so we will wrap up. Feel free to reach out to me or to Len at any time for any reason, and certainly we have the info here for NACU, and also an info box for our CPHQ, and any general questions you have can be directed to NACU. Thanks so much. We appreciate your time today. Have a good week.